Stem cells is a word that means a cell that is pluripotent, that can divide into many types of cells. Part of the idea of that is that they can become the target tissue if you're trying to grow cartilage or grow tendon. That's one aspect in how they may work. But they also secrete a lot of growth factors and they're called cytokines, or signals that influence pain and inflammation in a joint. And that's also a big part of how they work. You know, we see amazing results even just 2-3 weeks out after some of these procedures, which doesn't really line up with the time course that you would see for cartilage regrowth, for instance. So there's definitely an element of controlling the environment within a joint, and not just dividing and becoming those cells. So stem cells are kind of a word that's thrown around a lot, and in some cases it's not even referring to an actual live cell. So Regenexx at this point is primarily using bone marrow derived stem cells, which is the body's main source of cells that become tendon, ligament, muscle. That's where most of the research has been since 2006, was in bone marrow for orthopedic uses. There are also clinics that are using adipose-derived stem cells, so fat cell. But a bone marrow harvest is a relatively painless procedure with very few side effects afterwards. It's very safe. And so that's part of the reason why we choose bone marrow over adipose. And then the other tissue that's really out there is the amniotic or placental-derived tissues from birth byproducts that are donated. And so that's basically taking amniotic fluid and placenta, freeze drying it, irradiating it, basically making it into a shelf-stable product that can be just in a vial, and that's then reconstituted with water and injected into a different person. So those, they've actually tried to grow cells out of that, and there are no live cells in that product. It's basically a growth factor formulation with some extracellular matrix, which is basically the supporting structures that are around cells. And so it's really false advertising to call that a stem cell procedure. If anything, it's a growth factor procedure that would be at a lower level than like a platelet-rich plasma. So we would usually just use a PRP if we were using that rather than an amniotic tissue. You know, regenerative medicine has been going on for 15 years or so, and a lot of that early work was done using a machine, a bedside centrifuge, to separate out the platelet cells, or those machines are being used off-label often to create stem cell concentrates, nucleated cells from bone marrow. But Regenexx was really the leader in this stuff at actually making it by hand back in 2006, and they've been refining that process since then, which really allows you to individualize the treatments and concentrate them to whatever amount you might need for a given joint. If it's a very small joint, you'd go a more higher concentration, or if they're an older patient, you might need to concentrate those cells more. And it really allows you to tailor the treatment to not just in the joint injection, which is what you'd kind of be limited to with the smaller volumes you get from the bedside machine, but to really develop a more comprehensive plan to stabilize the entire joint and address all the pain structures, and not just a simple in the joint that would be akin to like a steroid shot.